Okay, moving on. Eyes. Remember we said, think about these creases. That's where my eyes are. Puppet. The eyes of a puppet.
And do you put the needles in
Crease.
transverse along or where?
Bam, bam.
In the middle.
Bam, yeah.
They're really
Sometimes I'll
small.
put two.
Ah,
I'll draw it up on the
okay.
wall. Glaucoma,
Dry eyes?
dry eyes,
I'll use that for the one.
trigeminal, stroke, droopy eye,
Bleeding
bleed eyes, yeah, bleed noise,
eyes.
stigmata, yeah.
Macular
I know you use your
degeneration.
crown,
Macular degeneration.
in communion with dark side of the force.
Anti-macular degeneration.
It's a tricky one. Needs herbs as well.
Retinitis pigmentosa.
Yeah,
I just met a
You
guy
need-
who came to Tai Chi class. He's going to Canada on a regular basis to get treatment for eye pain from somebody, from a doctor.
there's a famous clinic in Denmark, Acupuncture 2000. Have a look. They just all they
Tell me
do
he
is
doesn't have to go all the way to Canada.
Why is it?
just eyes. It's
Yeah.
acupuncture. You heard of it?
Yeah.
Dr. Sun, I think he said his name was.
One hand for both eyes, or no? If you were needling the hand, say for the eyes.
Both hands.
Both hands.
Maximise the image. How's that? The eyes are all right. Ears. Yeah. Same again. Just the other two. Ooh.
They was quite sore earlier on.
Ooh. Ooh. What's that? Left ear. Okay.
Remember they were really painful earlier.
I bet it's the
Working.
trapezius next, isn't it?
Yeah.
Yeah.
So this is the famous one in reflexology that always gets worked. It's crunchy as,
Okay, yeah.
and it's like come out this way, massage.
Yeah.
You can also massage this way. So our eyes are here, our ears are here, your neck, brain, thyroid, parathyroid. Okay? And I want you to have the sheet open like this all the time for the whole weekend. Because it's amazing how quickly you'll pick up, and you won't get everything, but you'll find something. Usually what happens is you're doing the routine and you miss something and you come lower down and you go, oh, a bit crunchy there. You can double check, oh, that's the lungs. Not the, I thought I was on the trapezius. Oh, that seems to be more like the lungs. Yeah? Yes, no?
Yeah.
Okay. Next.
No.
Lung. So this is the one I work quite strong with this young lady. She's a naughty little smoker.
Are they sore?
Do it right. There's no guilt about smoking, so it shouldn't be sore.
You know, there was sore earlier on now when the one was.
See how much effort I'm using?
It's a fine out.
And then press. It's a solid organ, the lung, not hollow. When you drown, you don't actually drown because the lungs fill up with water. You drown because the bronchi fill up with water. And that's what cuts off the oxygen supply. That's why it's morbid to talk about it, but after a few days, dead bodies float again. Gas and everything in the bowels, and then there's still air in the lungs. That's why the mafia favoured concrete boots. So, next. I think we're done.
Bronchi.
Then the heart, yeah? So for this one I come down, staying slightly away from Yong Chuan. And in fact, if I look at her feet, I can see a big white patch here. Can you see that?
Yeah.
And that's part of the trapezius. We check my diagram. So there's a lack of blood flow to the traps. Let's get on the roaring machine. This is good at that. Then back to the heart. Coming around. I like to really come up and around here. And then press. Release. Press. Press.
The heart. Are you going the right way with that?
Yeah, I come around this way.
You going up?
I come up and around. In the beginning we came
Feels
over
like
and
nauseated.
down.
Right.
Oh, okay, so too hard.
So is it?
No, in the
Should you
beginning
not
we
be
came
coming around?
down.
Yeah, so
Down.
you're going up this way then? No?
No. I'm going down this way.
Okay.
So you're going
I come
against the normal flow of blood, would that be right?
No.
Oh no, you're going with.
Alright, you're still going
Yeah,
the
it's
right
an L
way,
shape.
right?
Yeah, no.
Okay. So I felt that going.
Is it different to the first way you've done the heart?
Yeah, the other one went the other way.
Just more pressure.
Same
If you
direction?
look at where the heart's situated, yeah, you want to look for this crease.
Mhm.
You want to come up and down. Come across, down. So this is very light. It's very little pressure. Pressure and down. Yeah. To come into that bone here. Heart situated on this bone. Yeah, very painful.
I'm getting buzzing in this ear. Give me tonight.
Okay. So is that the routine so far? Yeah.
Mhm.
So to finish the routine then we need a bit of a flurry. So we do this movement. What's this called? Rofa. Okay. Then Safa or Kappa, down the sides with the whole hand, down the side and the inside this way. Bring the toes back with the soft part of your ulna striking. Stay on the heel, because we treated all this area here. Just stay on the heel for now. The heel area. Rofa again. This one just very fast mofa with a bit of a slap. And stand up, hand underneath the heel, leaning in, stretch the back of the Achilles, moving, using my body. And take the heel, rotate just the heel.
Jesus. Crunching a cornflakes. Oh.
So that concludes your treatment for the heart, the kidney, the bladder, urethra, sinuses, trigeminal nerve, cerebellum, cerebrum,
No.
lung, trapezius, bronchi, neck.
Trigeminal nerve.
Eyes, ears,
No.
huh?
Trigeminal nerve.
Nose, eyes, ears.
Thyroid.
Bloody hell. I'm exhausted, can go home now. It's a lot, isn't it? So this what I'm saying is, I don't expect you to do all that in one treatment with your patients. It's not going to be possible. In fact, when you've gone for the INMI massages in China, they really just do kidney, liver, spleen, stomach.
They just do the same routine though with everyone. They're not
Everyone.
treating, you know, they just
It's not
general.
medical, it's just
Yeah.
general.